YouTube program on the Auburn Medical Group. This is a unique week because Dr. Gwain is not here, and we're trying it in an actual exam room, so that's kind of a different thing. Although we used to do a lot of our production of procedures in these rooms, not so much this type of live YouTube talking to an audience about medical topics. We'll be talking about Dr. Gwain's blog post for today at the drgreenknight.com webpage blog. He's talking about the cost of doctors, actually how much the doctor fee is when you go to see the doctor. We'll be talking about that, and I do have a link in the description to the actual blog post if you're interested. And let me put up a phone number so you can call us. I'm still putting up the phone number. Oh my goodness. Okay, I do know how to do this. We'll put that up first. Put up the picture. And then. And it says the name of somebody who's not even here. So let's make that go away. Now you can see that we need a phone number. So let's get the phone number on there. And so I'm still working on that. Okay, the phone number for you to call, and we'll be able to hear you if you call because I've got the phone hooked up. And here it is. This is the number. So you can call if you have questions. Specifically, we're talking about the presidential executive order that went out last week. So let me get some information on that and also get to your questions, which I think we're still functioning. All right, so I'm looking for your questions. So on the chat, we have, oh, I'm on the chat. So we'll go back to the program for a little bit and then we'll come back to the chat. All right, so until we get some more comments on the chat, we'll go ahead and start talking about Dr. Gwain's blog post on the cost of doctors and how much they're charging. It's not really something that people have known, which kind of makes it hard to have a free market where the cost of goods and services is based on the demand and things adjust nice and evenly according to how much people need or are willing to pay for something. Well, we have this weird situation here in medicine where nobody knows actually how much their appointment costs. Quite often. I mean, if you get the EOB or explanation of benefits afterward, you can look at it and see how much you were charged or how much the doctor was paid after they charged your insurance. It's kind of a weird system with this middleman, so to speak, of the insurance companies that keeps it from being a straight transaction from the person receiving the services and the person providing them. So you get weird situations. Dr. Gwain in his today's blog post links to an earlier one where he actually lists the costs of different services from our office as kind of an example of an independent doctor's office compared to a big box service. When I say big box, I mean like a really large healthcare organization in an area. And so we checked with one of the ones in our area. We actually have 3 or 4 what I'd call big box in our area. We have Kaiser, we have Sutter, we have Dignity, we have UC Davis. These are all really big region-wide systems that have primary care doctors affiliated with them. And we happen to be affiliated with the Sutter system, which the hospital in our town is a Sutter hospital. But we go ahead and we compare ourselves to one of these big entities. Not only ourselves, but also an independent radiology practice. We also check for a cost of a mammogram. We also check for a physical therapist with a local physical therapist that we use. We also checked, in addition to that, what else is there? There's one other thing on there, I don't recall what it was, that we checked the price between an independent here locally and the big group. And the reason for the difference, and Dr. Gawain goes into this, is contracts. You see, you have to get your insurance priced by contracting with the insurance. So you tell them, hey, I'd like to make this much money when I do this amount of work. And they write back something like, well, if you're an independent doctor, something like, take the contract or not. We have no bargaining power. But when big box medicine makes a contract with the insurance company and they say, pay us this amount, and the insurance company says, well, we're not so sure we want to pay you that amount for that service, the big box comes back to the insurance company and says, oh, then say goodbye to these 20,000 patients that we have of yours who are going to change insurance to stay in our system. So they've got that bargaining power because they're big. And what it results in is they get paid by the insurance about twice what the independent doctor gets paid. And I've seen the EOBs, or explanation of benefits, that show exactly that for the exact same billing code, they get twice what we get. Now, that doesn't mean you're getting twice as good of care or twice as good of quality, or that their doctors went to twice as good of a medical school or residency. Not at all. It's just that they happen to be in the big group because they are able to get hired there, and we're an independent group. We prefer to have control over things. We prefer for the control to be in-house so that we decide how to best provide patients to our patients. Did I say provide patients? Provide medical services. And it's really small. So the guy on top, the medical director, the CEO, sees patients and gets called in to see the physician assistant or nurse practitioner patients when they want somebody else to give input on it. So the patients are in direct contact with the ultimate decision maker in an independent practice like ours, and many others too. So that's why we actually like this executive order from the president that says that the hospitals and the hospital affiliated physicians have to publish their fee schedules. We love that. We love letting people know what our fee schedule is. You just call up on the phone and ask, how much is a level 3 visit or a typical office visit? And we'll give you a level 3 and level 4 because we don't know which one it's going to be, and we do a lot of both of those. And you'll be able to compare it. You may not be able to get that from our competitors. And so patients who have to pay for their service or have a high deductible for their service, they don't know what they're paying when they call up and make the appointment on the phone, unless they call a place like us that tells. Well, now, thanks to this executive order, we're going to have a little bit more transparency. It may not be quite as much as we want. Dr. Gawain mentions in his blog post that we have a link to in the description that there may be a loophole for them. We're a little concerned about that. But we're more than glad to let people know, because we are very affordable. We are a place where healthcare dollars are saved in the United States rather than wasted or spent in excess. So at this time, let me take a look at the phone here where I can see if anybody's trying to call the phone number, but also go over to YouTube to read your comments and questions, or super chats as they may be. So let me pull that up here, and momentarily I'm going to disconnect you from the phone. The reason you're connected is so that you can hear the conversation if somebody does call in. And we'll go to the Auburn Medical Group, which should be having a live program. And let's see here. Let's see if we can find your comments and questions. So I'll turn this down. Oh, look, Dr. Gawain is on. Dr. Gawain says, yes, cash processes are available, but they are based on a percentage of insurance rates, more for big box, less for independents. Cash process are available? He's talking about cash discounts. I'm not sure why it says process unless he's trying to dictate to his phone, which he sometimes does. All right, let's back up a little bit and look at comments. We've got Megan McKnight, hello. Laura Spitz, hello. Bonnie Rodriguez, hi. And the reason we're doing this, those of you who watch this after the fact, is because this is done as a live program, and people chat with us during the live production of this show. Brio, hello everyone. Please, can you tell us the subject you're doing tonight? Laura Spears, they should all have prices available for those who don't have insurance. Yes, Laura, we agree. You just call us up and we tell you. Laura, that's why you can't find a private doctor on medical. Oh, Medi-Cal probably is what she's talking about. No, it's very hard to find a private doctor who takes Medi-Cal patients because you have to be subsidized to be able to afford to do Medi-Cal because it pays so little. So the way it works is the state pays through some kind of a subsidy to a clinic that takes Medi-Cal patients. That's how they're able to afford to do it. Independent doctor, you can't do it. It actually, I've heard some doctors who do it say it costs them more to have a biller and a coder and somebody in the office and an accountant sending in the claims and depositing them than they actually make seeing the patients. So that's kind of a downside to it. T. Lung says, hi all, happy Canada Day to all Canadians. Never knew that. July 1st, huh? Kind of close to 4th of July. And then Dr. Gawain's comment about the discounts being based on percentage. And we also do that. It's a percentage when we do our discounts. Okay, going back to your comments and questions. Let me refresh this. Yeah, it looks like Dr. Gawain's is actually the last one. So this is a subject we talk about quite a bit because it means a lot to us as independent physicians because we are significantly different from the big box doctors in our community as far as what's coming in from the insurance to our organization based on the care that we give to patients. And we want that message out because we think that healthcare can cost less. Even just primary care like we provide here, it can cost less than it does if we were to have these prices public and patients made decisions based on them. You would see possibly healthcare costs coming down. Now, the insurance industry is immediately mounting a response to this saying, no, it's going to raise prices. Well, how would it raise prices? This is how they say it's going to raise prices. They say it will raise prices in that when we see how much the big box guys get paid, we're going to try to get paid more. Yeah, I already know how much they get paid. I've already tried. That's nothing new. So it's not changing anything there for the big box guys to show how much it costs. It's going to be the patients who it makes a difference with, not me, because I know. I've got patients and family members who can bring home the EOBs from the big box medicine. I can see what the difference is. That's how we have that published in our blog, or Dr. Gawain's blog, which I encourage all of you to subscribe to. And if he was here, he would thank BooBoo Kitty for her support for it, just like I thank Lindsay Vaughan for her help in making this come to be. Those of you who are interested in helping with things like that, you can look at Patreon/Dr. Green Knight or Patreon/Dr. Vaughan if you want to get your name mentioned, for example. Let me see again if there's more as far as questions or comments from our viewers. And I think I may have a problem with refreshing it. Let me try it again. Yeah, I think that's what I wasn't refreshing. So going down to the comments, or the chat, I should say. Where's the chat? Live chat. Nothing new on the chat. Okay, and no phone calls. The phone number's there if you want to make a call. I can see that it's there, and you guys are welcome to call if you want. We'll go ahead and take it. We'll plug you in, let everybody hear what you're saying. Without that happening, though, I think what we'll do is plan on getting back together again next week with Dr. Gawain. I don't know if we want to do it in this room or not. You guys leave a comment in the comments about the sound. I know that this is a very echoey room compared to our studio where we normally do this. I just thought it'd be fun to do in a different location. I'm setting this up for doing some more clinical type of videos we might be making in the future, so I thought I'd give it a try here with you guys, see what you think. I'll check the comments later for it. Until next time, Dr. Mark Vaughan telling you to stay in good health.